Hello, my name is Dr. Thomas Zayden. I'm a board-certified plastic surgeon, and today I would like to present to my colleagues in law how to work with a plastic surgeon as an expert witness. My practice is in Miami, Florida. I've been in practice approximately 30 years, and I specialize in trauma. I've noticed over the years that a lot of my patients who are the victims of accidents find their way to a lawyer, sometimes to the plaintiff's lawyer, and occasionally to defense. Today, we're going to discuss how to pick a plastic surgeon, what we can do to help the jury understand the case, and what you can do to pick out an appropriate expert for your specific legal situation. I'm a board-certified plastic surgeon. There's many boards, but I am certified by the American Board of Plastic Surgery. I'm also a diplomat of the National Board of Medical Examiners, and importantly, I do a lot of forensic work. And the reason I can help the lawyer understand a case is I'm doing trauma. Not all plastic surgeons do cosmetic surgery. A lot of us do reconstructive, and we specialize in reconstructive. And these are the types of experts you should seek out and looking for someone to help you understand the implications of a personal injury case. We'll briefly talk about medical malpractice, but we're mostly going to focus on the evaluation of an expert to help you, the lawyer, in a personal injury case. So what is plastic surgery? Plastic surgery comes from the Greek word plastikos, which means to mold or give form. Interestingly enough, we mold and give form not only to victims of accidents, but to people that are looking to rejuvenate their body. So it's an encompassing definition. Most of the public feels like plastic surgery is the same thing as cosmetic surgery. In the past, our board was the Plastic and Reconstructive Board, but we've been trying to put in the public's mind that we rebuild victims of trauma, victims of accident. We frequently evaluate scars, like seen above, and it should be pointed out that scars are a big part of what we do. They can be treated in many ways, and what we have done over the years, besides plastic surgery, we've introduced modalities such as laser. What the laser can do is get the red out, and by getting the red out, you can enhance the healing process. The wound will soften, it will mature faster, and the less inflammation, the better it's going to heal. And this is a relatively new tool in our armamentarium, and there's various types of lasers, but normally we use a light-based laser, a more gentle laser, to deal with the scar. Then, after the laser treatment, we talk about plastic surgery. And that's what most people think about when we think about plastic surgery. But again, laser is a big part of what we do. This is typically done in an operating room. As you're looking at all these sophisticated machines, keep in mind that there's a lot of duplication. For example, the two monitors at the head of the bed is a backup monitor. There's two basically of everything, much like an airplane, because an operating room is meant to be a safe environment. During the plastic surgery reconstruction, whether it be immediate after the accident or subsequently, an entire team works to rebuild the patient toward some evidence of normalcy. Of course, the vital signs have to be monitored, the appropriate supplies in place, and more importantly, emergency equipment available should there be the need for it. Interestingly enough, fat cells, when most people think of plastic surgery, they think of liposuction, removing fat from the body to make the body slimmer. Well, as it turns out, these very fat cells can be used to rejuvenate the body. Fat cells have a tendency to reduce inflammatory process and introduce rejuvenation. So we are using fat cells more and more in conjunction with the laser to reconstruct the scar. And so you may see a report from an expert on the other side that talks about the use of fat cells for a scar. It is on label, it's being done all over the country, but it may not be something that you, the lawyer, are familiar with. So, in summary, scars in general can be treated with laser, fat cells, and at the proper time, plastic surgery. To expand about the timing of reconstructive surgery, children typically are not treated with aggressive surgical procedures. Usually, we wait until they're 18 or 21 until they're more fully grown. However, we may use the laser as the child grows because it won't have an impact on the changing tissues. So how does your expert evaluate a case? Well, obviously, we look at the medical records. And very often, the medical records are incomplete. And it kind of puts the expert at a little bit of a disadvantage to be looking at a record that is incomplete. While waiting for the complete record, a discharge summary is very helpful to your expert, and anything typed, any operative note, any images, any document that is typed and legible, and that can be sent to your expert to help expedite your handling and evaluation of a claim. Now, keep in mind very often that you need medical records about pre-existing conditions, because patients who have had cosmetic plastic surgery sometimes get into accidents, and it's important that your expert can evaluate what has changed, if anything, since the cosmetic surgery and the subsequent accident. The review of medical records is important, and just as important in plastic surgery are photographs. Photographs of the site, the idea of how it happened, photographs of what it looked like acutely, and photographs of what it looked like yesterday. This will help the defense lawyer understand when there's overreaching. Very often, we are asked to evaluate cases that apparently there's not much to see, a lot to read about, and that's where photographs in my field are critical, much more critical than in neurology, much more critical than in orthopedics. In fact, we can very often do a very good plastic surgical evaluation remotely. We've had the opportunity to see patients from all over the country digitally, or even just review records and photographs and give the lawyer who has asked us to look at something a good idea of what's going on. What's important, obviously, is you want an expert who has the ability to look at both sides of the case. You have to tell your expert, sometimes they forget, I really want an honest view of this. And it's interesting that very often the expert doesn't really get it. They think if it's a plaintiff requesting it, they're going to have to be plaintiff-oriented. If it's defense-oriented, it has to be defense-oriented. If you're a potential plaintiff, you really want an honest evaluation of what it is. If you're defense, you want to be sure that they aren't stretching the point. And in plastic surgery cases, like a lot of other personal injury venues, you really see, again, the word overreaching, ridiculous medical bills, ridiculous findings that really are overly described, but when you get right down to the patient's actual blood and bone, it doesn't pan out. And that's why you need an expert to help you understand the extent of an injury. Of course, this has to be in a way that is understandable, because your expert is not only a doctor, but he's being asked to explain to your client, explain to the court, possibly, a jury, possibly, the other side, possibly, what the situation is. It's important that you tell your expert you want him to be fair-minded. You want to know the good and the bad. Because in truth, the jury system, they will understand it. They will get it. Most of our cases are not complex, because most of the jury can see the scars, they can see the x-rays, they can see the burns. They're not cases that involve sophisticated issues. So you want an expert who is articulate, who's honest, truthful, who educates the jurors. And I found it interesting when I'm in the courtroom, the plastic surgery testimony is often the most interesting part to the jurors because it's something they can relate to. So my field, unlike others, we're lucky, it's a visual field and it's something that a lay jury can understand, and usually the attorney on the other side can understand. And again, the idea is to avoid court. As you know, 80 to 90% of the cases settle, but if you have an expert that can clearly explain to you the extent of plastic surgery injuries, it gives you the ammunition, especially when you have a fair-minded expert, to settle the case and be in that 80 to 90% that settles. Very few cases go to a verdict, but in general, if the liability is clear, and very often we have cases where the liability is clear, or the liability is even admitted, and so our job as a plastic surgery expert is to give a fair-minded approach to the situation, something that is accurate, something that's repeatable, and something that is understandable to both sides. So we're being asked to have a little bit of a crystal ball, kind of be like a life care planner. And that can be difficult at times to have a crystal ball, but in general, in plastic surgery, most things get better, which is very important, whether it be a burn from driving through McDonald's, whether it be a scar from a dog bite, no matter what the situation is, in general, it normally gets better. Occasionally, a patient will develop abnormal scarring, such as a keloid or hypertrophic. And that's why a fair-minded expert could acknowledge the possibility, but it's unlikely that those things could happen. And usually by the time you get the settlement, unless there's some sort of fast track, you'll know, your expert will tell you whether this is going to get better or whether it's just going to be a terrible situation, to keep that in mind. But again, I want to impress upon you the importance of knowing the mechanism of injury. A deep injury, a penetrating injury, whether it be from a dog bite, is going to be a very different impact than, say, an airbag deployment where there's some changes in skin color. And so you have this balancing. You have the defense saying that this is an horrific plastic surgery injury, and the patient was fine until the accident happened, whether it be a burn, a broken nose, whatever it is. Then you have the, I apologize, it's the plaintiff that's making those accusations, and the defense is pushing back a little bit, and it says, let's get realistic here. But in truth, the only thing the lawyer can do is get money. The lawyer can't heal the patient. So you have to come to some understanding of what's a fair-minded number. In my industry, we have a recognized schedule of fees. It's called the Relative Value Fee Schedule, and it's based upon what we call ICD-10 terminology. This terminology helps provide what we call a relative value fee schedule. So plastic surgery fees are published, so to speak, and they are easy to duplicate, and they are easy to use in figuring the value of what something is to fix or make it better. And this really takes a lot of the guesswork out of future medical cares. And a lot of lawyers don't know that there are recognized fee schedules for basically everything we do as plastic surgeons, and that these recognized fee schedules may have slight geographic variations or may have slight economic variations depending upon where and when the surgery is performed. But basically, these are hard numbers to pin down, and if there happens to be a catastrophic case and you're working with a life care planner, you can absolutely provide the codes to the life care planner, who can provide an idea of the future medical costs from the standpoint of what's reasonable and what's necessary. It's also important to note that the hospital or the emergency room may not be billing what is reasonable and customary. They may not be following the recognized guidelines. So when you're looking at hospital bills, you may see some outrageous number, but almost always they're subject to contractual agreements or government agreements, and it's important that you don't look at that number as a hard number, because in truth it should be repriced with the CPT, which is the procedure code or codes, ICD, which is the specific diagnosis of what's broken, and the relative value fee schedule. This can help you come to a settlement, and what is reasonable and what is medically necessary. And this helps a great deal in helping the court, if you will, understand the economic impact of plastic surgery injuries. Let's look at the word medically necessary. Medically necessary means that a procedure that is being performed for the reasons that improve the health and well-being of the patient. And this is a universal definition, and keep that in mind for any proposed services. Are they medically necessary? Interesting cases that we see, and you may see them in your practice, we see a lot of pressure cooker cases. We see people that are attempting to open or close a pressure cooker and they get burns. Your plastic surgeon can tell you the extent of the burn and tell you the temperature, because we have recognized formulas. We see a lot of barbecues that explode, and again, thermal injuries. We see, especially during COVID, a real uptick in hot water, tea, and soup burns during the course of going through a drive-through. And we can even help you a little bit with the liability, because we can help you understand the temperature that impacted the skin. We have recognized tables that can tell us temperature to create a first-degree burn, a second-degree burn, a third-degree burn. First degree, like a sunburn, it's no issue, and you may see some terrible pictures, but look at it now, the prognosis is excellent. Second degree, you may have some degree of scarring. It goes with either a longer duration or a higher temperature or a combination. Third degree is always scarring. That means that the skin has been burned all the way through. So, but the bad news is that a lot of times there's suggestions that these hot fluids cause burns that are, horrific and much more than you would expect, and your expert can help you determine exactly what the temperature was and the duration and the extent, the prognosis, and the future medicals. So what procedures do we perform? Again, we're not here to talk about cosmetic surgery, but it's interesting. You may see clients that have cosmetic surgery, have an accident. I've seen a lot of those, and your expert is necessary to point out what is from the accident, what is from the pre-existing condition. We see this a lot with breast implants. Any woman that has a breast implant, they sometimes get injured by the steering wheel, and your plastic surgery expert, even remotely, can help you ascertain whether it is reasonable that the implant of the breast impacted the steering wheel with enough force to cause a significant injury. We've seen disruption of plastic surgical wounds after car accidents. Again, your expert can give you a fair-minded approach to help the court understand the patient's actual condition. So these are a lot of the interesting things that we've done over the years. Plastic surgery is a lot more than just cosmetic surgery. It's a treatment of burns. It's a treatment of a fractured nose. And it's a treatment of a fractured jawbone. It's a treatment of a burnt hand. We operate all over the body, and we do reconstruction. We mold or give form all over the body. And it's important to recognize that we're not just cosmetic surgeons. And very often, when you're interviewing your expert, you want to get an idea if he's actively doing reconstructive surgery. And if it's really a catastrophic type of situation, you want a plastic surgeon that is actively taking care of catastrophic types of cases, burns that are over a large part of the body, for example. we've seen so many sad cases of carelessness where people just would walk into a fan and lose fingers. But these are things that a plastic surgeon can help you understand, because losing this finger is a very different impact than losing this thumb, for example. And that's important that you have an expert, not only who understands it, but who can explain it to the other side. And again, I wanted to remind you that plastic surgeons can tell you the temperature of the water, the type of burn, help you figure out whether this burn really did come from a hot water, or did it come from one of these pressure cookers that exploded, or if it was a gas burn. The type of injury has a very specific configuration. And if there's any doubt about exactly what happened, your expert can just focus in on that one little thing on the pictures and give you an idea without getting into the whole case. Expanding a bit on burns, as mentioned, you have first, second, and third degree burns. First is a sunburn, which is normally non-painful and does not require any specific treatment. A second degree burn is partial thickness. It goes through the skin down to the fatty tissue, and that can be quite painful because the nerves are quite irritated. But still, as a plastic surgeon, with the exception of using the laser, second degree burns are not a surgical issue. A third degree burn almost always results in permanent scarring and almost always requires treatment utilizing the laser, fat, and surgery. Usually, we wait until the burn is fully healed and additional time elapses after it being fully healed. Facts of the case, the good news is that we don't have to be a fact witness. We get to be an expert. We get to teach, which is something we all enjoy. We get to explain. We don't get too much into liability. We just explain the medical condition from the plastic surgery standpoint as best we can. Then we produce a narrative. I'm not going to label it a compulsory medical examination, independent medical examination. Whatever it is, it's a narrative. It's a plastic surgery expert's view on the case. And again, it's very focused, and it should be limited just to our specialty, unless they had an orthopedic procedure where there's some scarring. And in that report, your expert should talk about the plan, what the plan is, the alternatives, whether it be the fat, the laser, or the surgery, and the risks, because there are risks to any of the alternatives in the plan. He should, or she should, indicate to you whether it's a permanent injury. Also indicate to you a disability rating. We have recognized disability ratings for plastic surgery injuries. And this is sometimes overlooked, but there's an actual chapter, not only in the Workers' Compensation Guidebook, but in the AMA Guidebook as to the impairment of plastic surgery injuries. And your expert can opine as to a number and have a backup. And of course, any discussion should include possible complications, because treated and untreated complications are possible. And we work very closely with life care planners on catastrophic cases. The life care planner very often needs our input as to what codes, what fees, how many future operations from plastic surgery are reasonable, how many are medically necessary, and when they should be done, and what procedure. So keep that in mind on cases where there's catastrophic injuries where a plastic surgeon may be involved. It's good to work with a life care planner, preferably someone that you've worked with before, because rapport, not only between the life care planner and the hiring attorney, but the life care planner and the plastic surgeon expert, is imperative in helping the court understand the value of a case. So that's my overview about plastic surgery. We do a lot more than cosmetic surgery. We take care of a wide degree of injuries, and we help you, the lawyer, understand our discipline. Thank you for listening.